Okay. Dear participants, good afternoon to all of you. And there is a small technical snack from our side, and that has been resolved now. For that reason, we are using the new link. That link can be used for the future program also. And for that, I feel sorry for that. Okay. Anyhow, for this session, we have with us Professor T.B. V.S.V. Ramanaya sir as a resource person. Dr. T.B. V.S.V. Ramanaya sir obtained his master's in social work and PG diploma in psychiatric social work from NIMAS Bangalore, and PhD in social work and another PhD in sociology. In addition, diploma in population dynamics, PG diploma in HRM, etc. He has obtained more than 40 plus years of teaching, research, and administrative experience to his credit, and he published 80 plus research papers and 3 books in the area of social work. And under the able guidance of Professor Ramanaya sir, 18 students obtained their PhD degree, and he also served as former emeritus fellow in social work. It's a UGC initiation, and during 17 to 19, after his retirement as professor of social work, he served as a UGC emeritus professor in the same department, and he also served as honorary professor at Karnataka State Rural Development and Panchayat Raj University of Gadag, and is a non-official member of Karnataka State Mental Health Authority of Government of Karnataka, and is a esteemed member of the Collegium of Eminent Social Scientists constituted by ICSSR, Indian Council of Social Science Research of New Delhi, and of course is a regular resource person to our center since inception of this center, that is 1987. Is a regular resource person like the morning resource person Professor. With this brief, I welcome wholeheartedly Professor Ramanaya sir to this session on behalf of all the participants through online and also on behalf of the MT Center and University of Mysore. Over to Ramanaya sir.
Thank you. Friends, good afternoon. My presentation on student counseling services comprises of 2 parts. The first part is key terms used in the presentation, and the second part is the process involved in counseling, the application of counseling services in higher education institutions. This is the presentation way. Friends, before I make the presentation, according to me, there are 2 types of counselors. One is a student counselor. Second is a teacher counselor. A school counselor or a student counselor is on full-time basis. He is on full-time basis. He is a counselor. He doesn't take up any academic work. His functioning is only to function as a counselor, helping the students. What we have another category called as teacher counselors. We call them as lay counselors, or they are informal counselors. They help students and they work not on full-time basis. Their full-time work is teaching, and whenever they find time, they involve in counseling activities. But some amount of training is also required. We all belong to that category. Teacher counselors. But some are experienced, some are qualified counselors are there, but I'm referring to the teaching community in general. Okay, friends, who is a professional counselor? A professional counselor has an advanced qualification, academic qualification. He has completed the supervised training. He follows strictly the ethical guidelines of counseling. And finally, he is licensed to practice counseling. License issued by a competent authority. We call this person a professional counselor. But I'm referring to the other type of counselor. This type of counselor or this type of qualification is prescribed in many countries. But in India, the term counselor is not a protected term. That means no qualification is prescribed to become a counselor, except in Mental Health Care Act. Qualification is prescribed to a psychiatrist, to a clinical psychologist, and a psychiatric social worker to practice these services. Otherwise, the term counselor is not a protected title. But we are all come under that category of teacher counselors. You are good teachers, no doubt about it. But spare some time to work as a teacher counselor. We want everyone to work as a teacher counselor. Because teaching is more than imparting knowledge. It is something more than that. An inspiring quote for teachers is, what the teacher is more important than what he teaches. This is the quote by Carl Manninger. What the teacher is more important than what he teaches. So hence we say that as teachers, it is our duty to spare some time for counseling services. Of course, nothing is compulsory. Some teachers can take up this job. Okay, friends, the presentation comprises of two parts. One is key terms used. Second is the process involved. Counseling is a service profession, like a doctor, like a nurse. Counselor is also a service professional. And what is counseling? What counseling means empowering people. Counseling means enabling the person to manage his own activities. Counseling means helping the student or the person to understand his own problem and find solution to his own problem. That means it is based on the principle of self-help. But counseling does not mean providing information only. Counseling does not mean advice giving only. Counseling does not mean prescribing a quick fix solution. That is not counseling. Counseling means empowering people. Now let us see what are the terms which we use in counseling. The first one is counselor. Counselor is a professional who provides services to persons who are in need of help. Providing services to a needy person is called counselor. He's a counselor. Generally known as human service professional or a service provider. But such services are either proactive or reactive in nature. I repeat, the services of counselor are either proactive or reactive in nature. Now, what is a reactive service? Reactive means help is provided when the person asks for help. Providing help to a person who asks for help, or providing help to a person who is in need of help, whether he asks for it or not. This is called reactive help. You are reacting to the problem of the person. You are reacting to the need of the person. When someone has a problem or someone is in need of help, you provide services to them, whether they come to you on their own or you identify people and provide services to them. This is called reactive help. Another is proactive help. Proactive help means you are providing help to a person because it is your need to provide help. I repeat again, the person has not come to you for help. He has not asked for help. But you go to him voluntarily and you provide services to him. This is called proactive. In local terminology, it is very, very similar to dana. Dana ಮಾಡುವುದು. Dana means nobody comes and asks for dana. You go to people and provide this assistance to him. So, proactive help means help is provided because of helpers need to give rather than because receivers need to receive. He has not asked for help. Providing help is your need. Providing service is your need. You derive satisfaction by serving the other person. This is called proactive help. But similar other terms which we use, counselor, therapist, or helper, a very popular term is mentor. Mentor and mentee relationship. Mentoring is instituted in major industries. Who is mentor and who is mentee? Generally, mentee is a very young professional who has joined the organization as a fresh recruitee. He needs some amount of help and guidance from other persons, senior persons, and he is assigned to a senior person, and that person is called as mentor. A mentor is a senior person in hierarchy who is known for his integrity, known for his capability, known for his positive outlook. What I want to say is all senior professionals or all senior personnel will not become automatically mentors. We identify the mentor. A mentor is having progressive ideas, good character, honest in his profession, and he is really a model. And we call him as almost a godfather. But generally, mentor belongs to other department. If the young recruitee belongs to one department, the mentor usually will be from other department. The relationship between the mentor and mentee is called mentoring. The job of mentor is to help the young person to grow. The mentoring process includes informal transmission of knowledge, psychological support, and professional development. It's called mentor. The second is counselee. Counselee, also known as client in the terminology of counseling. Client, beneficiary, mentee, or protege in different contexts. Now, who is client? We use that term in the counseling process. Who is client? Client is an individual who seeks help, either individual or family that seeks help, or an individual is provided professional services is called client. Client is the receiver and counselor is the provider. You provide help as a counselor and the other person receives help. So client means a person who is in need of help. We call him a client. The client has the right to receive help, but you have no right to refuse help. Client has the right to receive help. Client has the right to discontinue your service at any point without giving any warning, without giving any signal also. In the practice of counseling, we regard the client as the maker of his own future. Ultimately, it is the client who decides what is good and what is not. He decides his own future. Ultimately, the decision will be taken by the client himself. We don't impose anything on the client, only in certain circumstances. He is called client. The next one is what do you mean by code of ethics? Code of ethics means a written set of ethical and value-based principles for a profession. Medicine has a code of ethics. Nursing has a code of ethics. Code of ethics means providing guidance in ethical decision making. As a professional, you are bound to follow these ethical principles. Generally, we say, what do you mean by principle? What ethics? Ethics means it will say what is correct behavior, what is not correct behavior, what is to be followed and what is not to be followed. So it pertains to right and wrong in conduct. It deals with what is good and what is not good. So you have to follow the code of ethics. I just mentioned certain code of ethics in code means a list of ethical issues. One is treat every person equal. Don't discriminate any person on the basis of sex, on the basis of nationality, on the basis of other factors. Confidentiality. Whatever information that is given by the client, by the beneficiary, keep it confidential and don't share this information with unconcerned persons. Not to receive gifts from the client. Don't accept any gifts or money from the client. Do not cross your professional boundary. If you are a counselor, you have to do the work of a counseling only, not to encroach into the domain of other professionals. Do the work of a counselor only. Don't use your authority for personal gain. Don't use your official position for personal use. And see that there is no dual relationship. Dual relationship means having two relationships with the same client. Okay, example, he is a patient in the hospital. You are the doctor. But outside, he is a partner of your business. This is what I say, dual relationship. Do not promise if you are not able to fulfill. These are all the code of ethics, ethical issues which you have to follow in counseling services. We say, finally, be loyal to your conscience. Be loyal to your profession. And be loyal to your employer or to the institution. They're all code of ethics. So out of all code of ethics, the most important code of ethical issue is honesty. Honesty is the most fundamental ethical issue. You have to act according to the profession. That means act in a professional manner. Obey the law. Avoid conflict of interest. Put the interests of the client above ahead of your interests. Be trustworthy and responsible. These are all ethical issues. Next is confidentiality. Whatever information given by the client, keep it confidential. There are two types of confidentiality. We follow only one type. One is absolute confidentiality. When I say absolute confidentiality means whatever information that is given by the client, whatever information that he has shared with you, keep it confidential. You promise him that whatever information that is given by him will be kept confidential and it will not be shared with anyone. It will not be made available in any other form. Nowhere I make a note of it. I always keep it only in mind, only whatever information you give. This is what we say absolute confidentiality. Practically, this type of confidentiality is not possible. What we follow in counseling services or in any profession for that matter is relative confidentiality. Relative confidentiality means keeping the information confidential. But when the occasion comes, you have to reveal it. The personal information of the client is a privileged information and should be treated with respect. When they say privileged information means your personal information. Your personal information, whatever you share that information with me, I will keep it confidential. I protect that information, except for compelling professional reasons. If there are compelling professional reasons are there, if there is something which warrants that, I will disclose that information. I will cross the boundary and I will reveal it to people when there is a threat to your life. When there is a threat to your life and when the court asks for information, I have to reveal this information. So what we follow in counseling services is relative confidentiality, but not absolute confidentiality. But you tell the client that whatever information he gives, that will be kept confidential. We follow this in healthcare services. Patients' medical information is kept confidential. But you have the right to know. It is confidential, but not confidential to the client. I want to know what is written in my case file. I want to know what diagnosis you have made. I want to know what is your line of treatment. I want to know everything. There is nothing called confidential here. You have to reveal everything. But to a third person, this information is confidential. So patient's medical information is confidential. In research, you get the data from the participant, you get the data from the subject in the form of interview or in the form of observation or in the form of other methods. You get the data. And that in data, you have to keep it confidential. You have to assure the person that whatever information you give, that will be kept confidential. So you have to get informed consent from the person. Informed consent means you have to inform the person what is your research, what are the objectives of the research, what data you gather from the person, in what way that data would be beneficial to him and to the society also. Everything I have to explain. Nothing to hide. So this is called as informed. Consent means after informing everything, I take your permission. That's called consent. So inform him first and take the consent afterwards. Total put together is called informed consent. That is also the most important ethical issue in research. And you have to assure, you have to promise the person that whatever information you give, that will be used only for the research only, and it will not be used for any other purpose. While gathering the information in the questionnaire, we generally say name. The first one will be name. Within bracket, we say, if you wish, you can avoid that. It is not compulsory. We don't want your name. If you want to conceal, yes, okay. If you want to avoid any question, you can do it. It's called confidentiality. So in business also, we follow confidentiality. The next one is psychosocial diagnosis. In counseling, we make a diagnosis. What is diagnosis? Let us say what is medical diagnosis, what is for psychosocial diagnosis. Medical diagnosis is different from psychosocial diagnosis. In the case of health services, the doctor would get information from the patient. He sends him for investigations, gathers information from the family members also, gathers information from all past records also. After conducting physical examination also, the doctor will come to a conclusion. That is what we say a diagnosis. On the basis of information from all sources, I come to a conclusion that this is the problem. But doctors will not arrive at a quick conclusion. The signs and symptoms are favorable. Out of 10 signs and symptoms, 5 are in favor of one disease and 5 are in favor of another disease, and finally we don't know what is the diagnosis at the end. We always think of differential diagnosis. We think of alternate diagnosis. Is it tuberculosis? Some symptoms appear like that's a case of tuberculosis. But some more symptoms are in favor of pneumonia also. But what is my final diagnosis? The doctor will say, I will go with tuberculosis. Put a question mark. I am not sure of it. I will follow up the case. I will get additional information. And finally, I make a diagnosis afterward. That becomes final diagnosis. So in differential diagnosis means a good doctor will never come to a conclusion in a hurry. Probably your diagnosis may be wrong. When the diagnosis is wrong, what happens? Okay, when the diagnosis is wrong, what happens? The line of treatment will also be incorrect. So a good doctor will wait. That's what we say, differential diagnosis and final diagnosis. And after making a diagnosis, you think of prognosis. What do you mean by prognosis? In medical terminology, prognosis means the chances of recovery from the problem. So and so is diagnosed as a case of tuberculosis. What are the chances of recovery? What are the chances of recovery from tuberculosis? For example, if the duration is very short, recovery will be quick. If the person is financially well off, recovery will be faster because he can take good food and he has access to medical care also. So all positive points, we make a note of it. And all negative points also, we make a note of it. Finally, we say prognosis is either good or bad. Good prognosis means recovery is faster, good, very good. Prognosis bad means it is almost like a hopeless case. It's a difficult case to hopeless case. Okay, this is what we say prognosis. Then you go for line of treatment. Then you follow up the case. and finally you terminate the case. This is the process which you follow in medical care. Study, diagnosis, treatment, follow-up, and termination. In counseling also, we make a study, we make psychosocial study, we make psychosocial diagnosis, and we apply line of treatment, follow up the case, and finally terminate. Then what is psychosocial diagnosis in counseling? In counseling, psychosocial diagnosis refers to the assessment of person in situation. Person in situation. Situation means the problem, the place of a person. What is the problem? What is bothering the person? Who are all involved in this problem? Where the problem lies? What are the causes of the problem? And what is the prognosis of this particular case? What help we can provide? What are the chances of recovery from the problem? But a caution is diagnosis on the basis of few facts is always hazardous. Don't come to a conclusion on the basis of few factors only. Get complete picture and then arrive at a conclusion. But in counseling, we don't have a disease like we don't brand a person. In medical practice, we say it is a case of tuberculosis. But in counseling, we don't say it is a case of something. We don't label a person. We don't brand a person. By branding a person, what happens? Branding always carries a stigma. So we don't brand an individual. Don't be in a hurry to come to a conclusion. Don't be in a hurry. Your diagnosis may be wrong. Your assessment may be wrong. Don't be in a hurry. Sometimes a symptomatic treatment is required. The same thing we follow in medical care also. Certain things, we were not able to arrive at a diagnosis. But what we do is we go for symptomatic treatment from the day one. We don't wait for the diagnosis and give treatment. Symptomatic treatment, especially allergy. If a person is having allergy, there is what type of treatment is to be given? The best treatment is find out the cause of allergy. Find out which substance is allergic to the person. This investigation will take a long time, but you can give treatment easily for the symptoms. So symptomatic treatment we go. So this is what we may say psychosocial diagnosis. Whatever is followed in medical practice, the same thing we follow in counseling also. Next is empathy and sympathy. Empathy and sympathy. Of course, it's not moving. Empathy is different from sympathy. Empathy is different from sympathy. Just 1 minute. What is empathy and what is sympathy? Sympathy means understanding other person's suffering. It is a feeling for others. In local language, we say, Ayo Papa. This is called sympathy, showing concern for other persons. Whereas empathy means feel like him, feeling like the individual. Sir, it is not moving, sir. ಸ್ವಲ್ಪ help ಮಾಡಿ sir. Computer move ಆಗ್ತಾ ಇಲ್ಲ ಸ್ವಲ್ಪ ಯಾರೇ ಕಳಿಸಿ sir. Empathy means feeling like the person. What is important in counseling is you have to empathize, not showing sympathy. Sympathy is of no use. Sometimes sympathy will aggravate the problems. So what is required is empathy. Empathy means experiencing someone else's feelings. I experience. If a person is failed in the examination, I understand the agony he experiences. Suppose I am the student. If I am failed in the examination, if I experience the pain, if I am able to communicate the same feeling back to the individual, that is called empathy. I repeat again, empathy includes three things. One, listen to him. Second, understand the problem. And third one is communicate back to him, both verbally and non-verbally. Example is, I understand your problem. I understand your situation. I understand that you have lost property, you have lost something in life. I understand the agony one experiences. These are all the examples of empathy. I understand how you feel. I can feel the pain you experience. This is called empathy. Feeling like him is called empathy. Feeling for him is called sympathy. Sympathy is negative, which should not be promoted, whereas empathy is to be promoted. So this is called sympathy and empathy. Next one is observation. ಸ್ವಲ್ಪ ನೋಡಮ್ಮ ಸ್ಟಕ್ ಆಗ್ಬಿಟ್ಟಿದೆ ಯಾರನ್ನ ಇಲ್ಲಿ ಇರಬೇಕು ಸ್ವಲ್ಪ observation and listening. Okay. Observation and listening. What is listening? Correct. Observation and listening, here it is typed as listening and observation. Now, what is listening and what is observation? Let us keep our eyes and ears open at all times and never fail to register what we see or what we listen. And what is listening? Listening is more selective than hearing. Hearing means you hear, the message will go to one ear and it will go out. Listening is more selective than hearing. Listening requires attention. Listening means understanding and not endorsing. I understand. I understand. Not, I don't accept whatever you say. That is not endorsing. Be non-judgmental. When you listen to people, don't say that you are wrong or you are right. Don't come to a conclusion. You are not a judge. Be an active listener. We have 2 ears and 1 tongue only to listen more and talk less. We can listen twice as much as we speak. Coming to observation. Observation means seeing and not looking. Observation is a skill on the part of the counselor. We can observe the client. Client means the person who receives help. We can observe the client from 3 different points of view. Observe him physically, his physical appearance, the way he dresses, the way he combs his hair, the way he walks in, the way he sits. Emotionally, his facial expressions, his eyes and his postures. Interpersonally, how the client reacts to counselor, negatively, positively, or neutrally. So observation means this is observation of non-verbal behavior. Non-verbal behavior means it is the bodies do not lie. Sharira yavaga, bodies will not lie. We cannot teach our bodies lie. So that means the physical appearance, the body language will convey some message. That is called observation. Next, paraphrasing. This is the word which we use in research. Paraphrasing means when you read a book, When one particular para is very impressive and you want to quote that in your thesis or in your research article, what do? There are two ways. One, as it is, you copy in quotation. That's what we say quotations. Put a quotation mark and as it is, you take. But there is another way that's called paraphrasing. Paraphrasing means read the para carefully, understand it, and write in your language only, and finally giving appropriate reference. This is called paraphrasing. Paraphrasing means understanding things and finally writing in our language only so that there is continuity in the presentation. The same way, in paraphrasing, we say, take the clue from the client and ask questions. Take the clue from the client. Just now you said that you lost interest in studies. Just now you said that you have lost interest in studies. Could you tell me more about that? Could you tell me more about that? I want to know more about that information. Now, what I understand from your description is this. This is called as paraphrasing. Paraphrasing means whatever the client speaks, understand it, and again convey it back to him in our language only. That is called paraphrasing. It is a therapeutic technique which we use in counseling. That means rephrasing the client statements, allowing the client to better understand and analyze what they have said. Next one is privileged communication. What is privileged communication? Privileged communication is legally protected information. It is an ethical aspect. It is a communication between the counselor and the counselee. The communication between counselor and counselee is protected unless the client gives permission for it to be shared. Whatever information the client gives, that is called privileged information that he is giving, and we keep it confidential. So that's what we say, privileged communication. Whatever a client writes a letter to you, keep it confidential, privileged communication. He wants to share something with you, keep it as privileged information. Okay, next one is psychiatrist, clinical psychologist, and psychiatric social worker. I said legally approved qualification. To practice counseling services in mental health settings, you need to have this qualification. If you don't have this qualification, you cannot use counseling services with the persons suffering with mental illness. Of course, we use counseling, we use psychotherapy in mental health centers, but we have a legislation. The name is the Mental Health Care Act of 2017. According to that legislation, who is a psychiatrist? A psychiatrist is a medical practitioner having studied MBBS and MD in psychiatry, 3 years MD or 2-year diploma in psychological medicine from a university recognized by UGC and also recognized by the Medical Council of India. Then only he is called a psychiatrist. In addition to MBBS, either diploma of 2-year duration or 3-year MD, and some they do both. First they complete diploma 2 years and afterwards they join MD. That becomes afterwards 2 years only. So DPM and MD, they are called qualified psychiatrists as per the law. Clinical psychologist, PG degree in psychology or clinical psychology or applied psychology. In addition to 2-year full-time MPhil course, which includes a supervised clinical training from any university recognized by UGC, approved and recognized by Rehabilitation Council of India, then only we call him as a clinical psychologist. He is authorized to practice counseling and psychotherapy with the mentally ill persons. So who is a psychiatric social worker? PG degree in social work with the 2-year full-time MPhil course in psychiatric social work, which includes supervised clinical training from any university recognized by UGC. Only these professionals only are entitled, they are authorized to practice counseling with mentally ill persons. The qualification is prescribed in the act itself, not in the rules, but in the act itself, which is more powerful. And hence, to function as a counselor in mental health field, this is not possible unless you have this qualification. Okay. Next, what is a rapport? Rapport means a close and harmonious relationship in which both the counselor and counselee understand each other and communicate well. It is a strong working relationship between the counselor and the counselee, between the counselor and the client. Good relationship between the two is important. So, rapport means developing a strong working relationship between counselor and counselee built on mutual trust, mutual respect, genuineness, and motivation for growth. This is what we say rapport. Rapport means a harmonious relationship between the counselor and the client. But how do you get rapport? How do you establish rapport? Is it easy? Means rapport depends on how we talk, what we talk, how we respond, and how we follow ethical guidelines. It all depends on this. If you talk very well, rapport can be established easily. So what we talk and how do you talk? How do you respond? How do you behave? All will count in establishing a rapport. Now, why this is important? Unless you establish a rapport with the client, your counseling will not be effective. So a good relationship between the client and the counselor is required. And that relationship is called as rapport. Rapport means a professional relationship. You are a student, you are a teacher, and the other person is a student. You are a counselor, he is the client. The relationship between the two should be that much only, should not go beyond that. That's what we say professional relationship. And the relationship should have a purpose. What purpose is there? You have come to me with a problem. I am here to help you to solve the problem. That is a relationship only. That much relationship only we have. So the relationship has a purpose. Once the purpose is achieved, the relationship also will be dissolved. And the third one is positive. The relationship should always go in the right direction only, not in the wrong direction. It should be progressive. It should go towards the goal. It should be on the way to reach the goal. So, rapport means a professional, positive, purposeful relationship between the counselor and the counselee, or between the counselor and the client. Okay, this next one is, what is stress? The first person who used the term stress medically was Hans Selye. Today, stress in the modern times is often called a new age killer because it is linked to many health problems. Stress is related to many health problems. If the stress is unmanageable, if the stress is beyond the capacity of the individual, he may develop different medical problems, different psychological problems. Anxiety or depression or fear, and medical problems like hypertension, heart diseases, and sleep disorder. So it is finally a social challenge. and definitely not a genetic medical problem. Stress is not genetic in nature. Stress means, please understand, stress and stressor. Stressor means life situations or events, occasions, conditions, and incidents are all referred to stressor. I repeat again, life situations or events, occasions, conditions, incidents are referred to as stressor. Marriage is a stressor. Death of a friend is a stressor. Getting a job is also a stressor. Marriage is a stressor. All are called stressors. Stressor means the cause for the stress. What happens to us is not stress. What happens to us is not stress. But how do we react to the stressor is stress. How do you react to the failure in the examination is a stress. How do you react to the death of a loved person is a stress. How do you react to a promotion is a stress. So stress need not be negative or positive. It is only a change. That's what we have to say. Stress need not be negative. Stress also can be positive also. Marriage is a stress. Promotion is a stress. Getting praise in the lottery is also a stress. How do you react to that is called as the amount of stress. Failure in the examination, for example, if the student takes it very, very seriously and very, very sensitive person, that means the stress will be much more beyond his capacity to manage. Because his perception is that one. His reaction to the stressor is very severe. But if he takes it very, very lightly, not at all bothered about failure of examination, then the stress level will always be less only. That means the stress depends upon our reaction to the stressor. Our reaction is in our hands only. In our hands only. Hence, you have to react appropriately. Okay, so you can control the stress with the appropriate reaction. The reason is all will not react in the same way to the stressor. Some are very, very sensitive. They take extreme step when once they come to know that they are failed in the examination and there is a failure in the business, they go to extreme step. Some are very sensitive and their reaction is very, very severe. But some are very sportive. They take it very lightly. And some will say that, yes, it's a failure only. I should worry about it, but I should appear for the examination. Once again, I'm sure that I will get better mark. This is called sportiness. The emotional signs of stress are especially depression and anxiety. Depression. The person, if he is depressed, what happens? A depressed person will not sleep properly, less sleep only. He will get up very early in the morning. He will lose interest in all activities. He prefers isolation. He doesn't mingle well with people, doesn't enjoy his food, doesn't enjoy his social relations also, doesn't bother much about his personal hygiene, sits in the darkness only, always looks at the bad side of the life only. All are depressive features. Some are very anxious. What will happen to us? When the person is anxious, what happens? The blood pressure level shoots up. The heart rate goes up. Sweating will be there. Trembling will be there. So these are all problems of anxiety. So when the stress is unmanageable, we have different types of problems. So long-term stress is also called as chronic stress. Chronic stress may lead to health problems which include small things like headache, sleep disturbance, digestive disorders, and other problems. We use two terms related to stress. One is distress and another is de-stress. D-I-S-T-R-E-S-S, distress. Distress means a state of severe anxiety or suffering. A severe anxiety and suffering is called as a distress, D-I-S-T-R-E-S-S. De-stress, D-E-S-T-R-E-S-S, de-stress means doing something to become less stressed or anxious. That means to relax both body and mind. That's what we say. Doing something to change. That's what we say, de-stressed. Example, when you work hard from morning till evening, when you come back home, you take a hot water bath. Taking a hot water bath is a good way to de-stress after a busy day. Doing yoga is a way to de-stress. Listen to a pleasant music is also called de-stress. De-stress means keeping yourself away from the stress. Listen to good music, you relax. Doing yoga, you relax. Taking a hot water bath in the evening after a hard work, that is also called de-stress. But most of us react to stress in four ways. The first one is we do not acknowledge in the first place. We don't say that there is a problem. Nothing has happened to me. That's called denial. The first reaction to a stress is nothing has happened to me. I'm fine. Second, we acknowledge, we accept it, but exhibit actions of denial. Nothing has happened to me, a small problem only. No problem, I can manage it. Third one, we deal with it. We deal with the problem. And last one is we let it control our reactions only. Finally, you are the loser, the last one. So that is how we react to the stress. But how to control stress? Some of the techniques are there, the three important techniques are there to manage the stress. What are the stress management techniques? Three important techniques. One is forgive. Forgive. When we forgive, definitely the level of stress also comes down. Completely dropping the anger and moving on without looking back. Whatever level of anger you have, everything, by forgetting, you say, forgive. Forgive and forget. This is one way of managing the stress. Forgive so that you are very comfortable. Second thing is flight or fight. Fight means quarrel. Flight means running away. So either you fight or you run away. Both are not good options. You have to think of the third option. Flight is also not correct. Fight is also not correct. So don't go for a quarrel. Don't run away from the battlefield, but think of the alternate. The last one is sleep. Relax and sleep well. This is the last one. Sleep will always bring harmony in the mind. Relax. That's why Shakespeare is very fond of the term sleep. He has mentioned that in almost three dramas. According to him, sleep means, oh sleep, oh gentle sleep. That's what his words are in Henry IV play. So, when you sleep is a natural part of life, essential for physical and mental well-being. Please understand, stress is a major problem in the present times. We have to find new ways of coping. Here, I will just give one illustration, a research study I will quote. Three others have contributed a research article. The research article, the gist is like this. In one study of college students, a big college having many students, What the researchers have done is divided the students into two parts, two equal parts. One part is having a large size of students, the other side also having the same. The first batch of students are given topics. What topic they have given is nothing to write, but they have been asked to write whatever pain they have experienced in the college, whatever trouble they have experienced, whatever difficult situations that they have experienced on the campus. All difficult experiences they have to write. Your experiences on the campus, your trouble, your inconvenience, your stress, whatever you have experienced, you write in a detailed way. There is no topic at all. So everything is on the basis of your personal experiences only. The second batch of students were given 3 different topics. So you select any one topic. One is poverty, another is population, and the third one is price rise. I'll start with P only. Price rise, if you want, you take up that topic. Population or poverty. So they have been asked to write, the first batch were asked to write their own experiences, their own emotions on the campus. The second were given definite topics to write. At the end, they found that those who wrote their own experiences, their mental agony, their mental tensions, they were very happy subsequently. And those who wrote other topics, their problems remained same only. So the meaning of this study is finally, if you are able to express your own emotions, that's what we say, ventilation or catharsis. Catharsis means your emotions you pour out. You share your emotions with some other person. Once you share your emotions, the intensity will always come down. Generally, we go to a temple and pray God and tell him everything, whatever we have, whatever is there in our mind. Okay, this is what we say. This is what we say catharsis, ventilation. So ventilation means pour out your emotions. Whatever emotions you have, don't swallow the emotions, share the emotions with people. Once you share, some relaxation will be there, some comfort also will be there. These students have expressed all their inner problems, whatever they have experienced, which they have not shared with anyone. These are all my troubles, these are all my problems, these are all inconveniences which I have. An opportunity is given to them to ventilate, to express. There are many problems, many inconveniences students may be having, but the moment you give an opportunity to them, they will express everything openly. So one more thing they said is, while writing your experiences, please don't quote your name if you want. What we want is the content only, not name. What problems you had on the campus? So the moment you express all the problems openly, without any hesitation, they feel very much relaxed afterwards. And those who have taken up other topics, they continue to suffer in the same way. This is the gist of that empirical work. Okay. Finally, we say that end note is the technique of counseling revolved around 4 aspects. The technique of counseling revolved around 4 aspects. One is listening. The most important one in counseling is listening, not talking. Talking is not important. Listen to people. Listening is important. Listen with interest. Listen with concentration. Listen to understand, not to argue with person. So listening. The second is empathy. Feeling like the person. I understand your problem. If same thing has happened to me, if the problem comes to me, how I react to it, understand that and communicate back to him. This is the reaction. That's what we say, empathy, feeling like the client. That's called empathy. Ethics. We have code of ethics. We have to follow these ethics meticulously. Empowering. Finally, counseling means empowering. Counseling means making the person powerful. Empowerment means not giving power to person. Making the person powerful is called empowerment. Okay, friends. Now the next is what do you mean by counseling? Counseling is a behavior change strategy. A behavior change strategy. Counseling is a behavior change strategy, involves a direct contact with the client, and is by definition a remedial process. I will just explain. Counseling is a behavior change strategy. Strategy means it is a goal-directed action plan. The purpose of counseling is to bring a change in the behavior of the individual. A change from negative behavior to positive behavior. From unacceptable behavior to acceptable behavior. That's the goal of counseling. A change in the behavior is required. That involves a direct contact with a client. It is a behavior change strategy, involves a direct contact with a client. When we say direct contact with the client means we have three types of counseling which we use. One is telephone counseling, the second is online counseling, and the last one is personal counseling. Telephone counseling relies purely on voice calls, highly accessible to all. Anonymity is there, high degree of privacy. But only problem is you can't understand the body language of the person because the person is not visible. Good for those people who prefer auditory communication. Some people want to communicate only, they don't want to be seen by others. There is one type of telephone counseling, which is accessible to many people, remote areas also. The second one is online counseling, conducted over internet, using video conferencing platforms. But advantage of this type of counseling is we can read the facial expressions and body language of the person. Very confident, you can keep the information confidential. There is no social stigma. When I say social stigma means there is nobody to ridicule you, to make fun of you. But if you go to a counseling center, if you wait for the counselor, if somebody sees you, your own friend sees you, he will say that you have some problem. We don't want to be identified by others that we have a problem. This is what we say stigma. Stigma means fear of being ridiculed by people. Somebody will make fun of me. The moment they see me in the counselor's room, I don't want to go there. This is the approach of some persons. So it is confidential, and online counseling will not have stigma. There is privacy. It is very convenient, accessible also. There is no geographical boundary. Only thing is, all will not be able to get it. It requires a device and a stable internet connection. This is the advantage and disadvantage of both. So after COVID-19, the online counseling has become very, very popular now. You need not go there. You fix up a time and talk to the person. It's good. But we have one more called as personal counseling, which is very, very effective compared to the other two. Counseling is a behavior change strategy that involves direct contact with the client. Direct contact means a face-to-face contact. He is sitting before you. I am here and he is there. So this is called as direct contact, and is by definition a remedial process. Remedial process means it is finding a solution. Remedy means solution, finding a treatment, finding a solution to the problem. Second one is essentially counseling involves an attempt to help the individual to mobilize his own resources. his own resources, means it is self-help. The best strategy is self-help. You are able to help yourself. The ultimate goal of counseling is to make the person decide what is good and what is not good and decide the course of action. Finally, his course of action, everything will be done by the client only. The final decision will be taken by the client only, because it is his future, it is his life. What is good for him, he will be the decision maker and not the counselor. I don't say what you should do. You decide what is good for you. I am here to clarify. I am here to explain everything to you. I am here to say everything to you. I make everything very, very clear to you. And finally, you decide what is good to you. You can go in this way, you can go in this way, you can go in this way. You can go different ways. And finally, you decide what is good for you. Counseling involves an attempt to help the individual to mobilize his own strength, resources, and utilize them to resolve certain difficulties which confront him. Counseling involves a professionally trained counselor assisting a client with particular concern. Next definition is a very popular one. Counseling is to empower the client. The purpose of counseling is to empower, to make the person powerful, to make the person decision maker. That's what we say, empowerment. You decide what is good for you. Who has to take the action at the end? Finally, it is the client to decide his own future. So counseling is to empower the client to cope with the life situations. That means effectively dealing with the life situations like death or marriage or any other thing. That's what we say, events, occasions, conditions. It may be negative or it may be positive also. So counseling is to empower the client to cope with the life situations. Cope means to overcome it, to deal effectively with the life situations. It may be good situation, it may be bad situation also. It may be the death of a person or it may be a promotion also. To reduce emotional stress. To reduce emotional stress. That means depression, anxiety, anger, tension, all things are to be reduced to the minimum. Dealing with these problems, depression. To engage in growth producing activities, it means development activities. And finally, to make effective decisions, decide what is good for you. Counseling means rendering intellectual and emotional support for helping and developing a distressed person. Okay. Now let us come to the other topic, counseling services in higher education institutions. Stress and isolation are found to be the major problems of students of colleges and universities. Many universities have set up student service centers. When we say universities, means colleges, even polytechnics also have set up student service centers. We have it to different nomenclature. In some universities, the centers are called as counseling centers, other centers is called as student service centers. You give different name to it, but finally, many universities have set up and many universities are on the way to set up. Probably by the end of this year, probably all universities will have the counseling centers on the campus. Now, what do these centers do? These centers guide the students. These centers guide the students towards academic, professional, and personal success. Personal success. Further, the centers are expected mainly to manage problems related to stress and emotional adjustment. These are all main things. So these centers guide the students towards academic success, professional success, and personal success also. Find out what problems they have on the campus. provide counseling services. But these centers work in close liaison with mental health centers. This is compulsory, this is required. Because most of these problems are mental health problems. If a person is unhappy, you may deal well with the problem. If the person is extremely unhappy, then you need a professional help only. That means all colleges and universities must have a tie-up with the nearest mental health center so that problems which are unmanageable, problems which are difficult to manage, you can refer those cases to the mental health center. So every college must have a tie-up with the nearest mental health center so that you can deal with the problems related to stress and emotional adjustment. Another thing is a subject on mental health is included in the curriculum. It's almost compulsory that you should have a paper exclusively on mental health so that it would help the students. How to overcome the problems, what are the mental health problems, how to minimize their intensity. A subject on mental health is included in the curriculum. And these centers, these service centers, these student service centers are managed by a director or a dean level position equivalent to a professor's rank, especially in the disciplines like psychology, sociology, social work, physical education, and sports. Only professors cadre from these disciplines only, they have to function as a director of the counseling centers. And these directors would appoint counselors also. Okay, friends, I think it's a time for a break, and we will meet. 3:45. We will meet at 3:45. Thank you. Okay. Are you listening to me? No.
Yes, sir.
Yes, sir.
Yeah, ma?
Yes, sir.
Okay,
Yes,
we'll meet at 3:45.
Yes, sir.
Yes,
Yes,
sir.
sir.
Yes,
Yes,
sir.
sir.
Yes,
Yes,
sir.
sir.
Yes, sir.
Yes,
Yes,
sir.
sir.
Yes, sir.
Yes, sir.
Yes, sir.
Thank you, sir.
Yes, sir.
Thank you, sir.
Thank you, sir.
Thank you.
ಯಾರನ್ನು ಬಂದ್ರಮ್ಮ ICC ಇಂದ ಯಾರನ್ನ ಕರ್ನಾಟಕ
Yes, sir. Yes, sir.
ಯಾರು ಗೊತ್ತು ಸರ್?